P syndrome, Western differentiation, psoriatic arthritis. Psoriatic arthritis is a particular pattern of arthritis seen in association with psoriasis. The clinical features can be classified according to the 5 clinical patterns identified by Wright and Moll: asymmetrical oligoarthritis, symmetrical polyarthritis similar to RA, psoriatic spondylitis affecting the spine or the sacroiliac joints, distal interphalangeal predominant and arthritis mutilans, a severe destructive form. More easily, they can be divided into oligoarthritis, polyarthritis, and axial skeleton arthritis. These patterns may overlap. Approximately 80% of those affected develop inflammation in their joints after the onset of psoriasis, but in approximately 20%, the arthritis may be present before psoriasis. The joints affected may become tender, swollen, and stiff. In some cases, psoriatic arthritis may mimic other forms of chronic arthritis, and indeed having psoriasis does not preclude individuals from developing other forms of arthritis. In some cases, the differential diagnosis between psoriatic arthritis and other forms can be clinically challenging because there are many similarities in their manifestations, as it happens with symmetrical polyarthritis and the actual forms of the AS. However, some symptoms are clearly distinctive of psoriatic arthritis, such as the involvement of distal interphalangeal joints, enthesitis, the inflammation of the entheses, the sites where tendons or ligaments insert into the bone, shortening of the fingers due to osteolysis and nail dystrophy. Examination of the nails, therefore, is most important. From the Chinese point of view, nail disease is often due to chronic blood stasis. Psoriatic arthritis can develop at any age from early childhood and teenage years to later in life. Men and women are almost equally affected, and there is some evidence that in females, both following childbirth and during menopause, there may be certain hormone-related changes that trigger the onset of arthritis. It would seem also that men are more prone to developing arthritis of the spine and women more severe disease of other joints. There is no specific test. Most doctors would look for a history of psoriasis in the family together with arthritis and inflammation in at least one joint. There are no antibody markers, unlike RA or lupus. Thank you for your attention.